The truth is, on your first day of your primary care rotation, you are going to suck at an otoscopic examination, just like how I did. So here are the ways to prevent that on your first day, because I clearly remember my first patient that I had to see on my first day of your primary care rotation was a clogged ear. My first tip is always look at the normal ear first compared to the bad one, because now you will have a baseline of severity where you can compare the two and then make physical exam finding judgments. Second tip is when using an otoscope, make sure you use a pediatric speculum for pediatric patients for especially preventing ear canal trauma. My third tip is before actually inserting the speculum, you have to manipulate the ears in a way that you can actually see the canal and the tympanic membrane. For peds, you have to pull out and down. For adults, you want to pull up and out. This way will allow you to see all the structures clearly. And if not, you can always maneuver the speculum to see where actually the tympanic membrane is. Now let's talk about the common pathologies. So if you, let's say, look at a normal ear and then you come on to the bad ear, if you cannot insert the speculum, then the suspicion for swimmer's ears goes up. If you can see the tympanic membrane and the cone of light, but the effector ear, you cannot see the cone of light, then assume that there is a lot of fluid behind the ears. And you can safely say, with obviously the other clinical findings in picture, that this patient may have some middle ear infection. If there's bleeding from tympanic membrane and the tympanic membrane looks damaged, then it's possible that it's a tympanic membrane rupture. If you do an otoscopic exam and you find the canal is swollen, the tympanic membrane is angry, and you cannot see any landmarks on the tympanic membrane, then you can also consider outer ear infection as well as middle ear infection. Follow for more if you like these tips.